Hello, and a very warm welcome. I'm so glad you've chosen to spend this time with me today for what I believe is one of the most important conversations we can have about our health as we navigate our senior years. I want you to picture a scene that might be familiar to you. You're standing in the supplement aisle of a pharmacy or a health food store. You're surrounded by hundreds of bottles, all with beautifully designed labels and promising words. Words like vitality, rejuvenation, memory, joint comfort, and ageless. It can feel both hopeful and incredibly overwhelming. There is a powerful allure to the idea that we can find an extra measure of health, a safety net, or a solution to an ailment, all neatly packaged in a capsule or a tablet. This allure is completely understandable. As we grow older, we become more attuned to our bodies and more proactive about our health. We want to do everything in our power to maintain our strength, our mental clarity, and our independence. The supplement industry has grown into a multi-billion-dollar enterprise largely by tapping into this deep and valid desire. It offers the tempting promise of an easy solution, an insurance policy, against the uncertainties of aging. And because these products are often labeled as natural, we are led to believe that they must be safe. We think, it comes from a plant, so how could it possibly be harmful? Today we are going to pull back the curtain on that assumption. We are going to have an honest, in-depth, and sometimes surprising conversation about the truth behind the supplement industry. Our goal is not to demonize all supplements. Some, like vitamin D or B12, can be incredibly beneficial and even necessary for many seniors under a doctor's care. But our purpose today is to act as a trusted and cautious guide. We will illuminate the fact that the supplement industry is largely unregulated, a wild west, where promises often far exceed the scientific evidence. We will learn that natural does not automatically mean safe, and that many of these seemingly benign products carry very real risks, from interacting dangerously with prescription medications to causing direct harm to our bodies. We are going to specifically identify several popular supplements that seniors should approach with extreme caution, or avoid altogether. Before we go any further, I must state this with the utmost clarity and sincerity. This information is for educational purposes only, and is not a substitute for professional medical advice. The single most important takeaway from our entire conversation today is this: you should never start, stop, or change your dose of any supplement without first having a thorough conversation with your doctor or your pharmacist. They know your personal health history, they understand your current medications, and they are your most valuable partners in health. Today, our goal is to empower you with the right questions to ask and the knowledge you need to be a safe, informed, and critical consumer. Your health is your most precious asset, and protecting it is our highest priority. Let's begin our exploration with a category of supplements that perfectly illustrates a fundamental principle of nutrition: that it is possible to have too much of a good thing. I'm talking about high-dose fat-soluble vitamins and certain minerals. Our bodies have two main categories of vitamins: water-soluble and fat-soluble. Water-soluble vitamins, like vitamin C and the B vitamins, are relatively forgiving. If you take more than your body needs, it will generally excrete the excess in your urine. Fat-soluble vitamins, on the other hand, namely vitamins A, D, E, and K, are different. They are stored in your body's fat tissues and in your liver. This means they can build up over time, and if taken in high doses from supplements, they can reach toxic levels that can cause serious harm. This risk is particularly pronounced for seniors, as our liver and kidney function, the organs responsible for processing and clearing substances, may naturally become less efficient with age. Let's first discuss vitamin A. We need vitamin A for healthy vision, a robust immune system, and cellular function. When we get it from food, it comes in two forms. From animal sources like liver and dairy, we get preformed vitamin A, called retinol. From colorful fruits and vegetables like carrots, sweet potatoes, and spinach, we get provitamin A carotenoids, like beta-carotene, which our body converts to vitamin A as needed. The problem arises with high-dose supplements containing preformed vitamin A or retinol. For years, people believed that more was better. We now know that for seniors, high levels of supplemental retinol can be dangerous. Most alarmingly, multiple large studies have shown a link between high intake of retinol from supplements and an increased risk of bone fractures, particularly hip fractures. It appears that excess vitamin A can interfere with vitamin D's crucial role in maintaining bone health, leading to weaker bones. Furthermore, because it is stored in the liver, chronically high doses can lead to liver damage. The safe path is clear. Get your vitamin A from your diet. Your body is brilliant at taking beta-carotene from a sweet potato and converting just the right amount it needs, without the risk of toxicity. High-dose vitamin A supplements should be strictly avoided unless you have been diagnosed with a specific deficiency, and it is prescribed and monitored by your doctor. Next in this category is vitamin E. Vitamin E is a powerful antioxidant, and for decades it was hyped as a miracle supplement that could protect against heart disease and cancer. Many people began taking high doses, often 400 international units or more per day. However, extensive and rigorous scientific research over the past 2 decades has not only failed to support these claims, but has actually revealed significant risks. Large-scale clinical trials have found that high-dose vitamin E supplementation does not prevent heart disease or cancer. More concerningly, it has been linked to an increased risk of bleeding, specifically hemorrhagic stroke, which is a bleed in the brain. This is because vitamin E can interfere with the body's blood clotting process. For a senior who is already taking a daily aspirin or a prescription blood thinner like warfarin, clopidogrel, or one of the newer anticoagulants, adding a high-dose vitamin E supplement is like pouring gasoline on a fire. It can create a scenario of dangerously thin blood and a risk of uncontrolled bleeding from a minor injury. Some research has also suggested a link between high-dose vitamin E and an increased risk of prostate cancer in men. The message from the scientific community is now resounding. Avoid high-potency, standalone vitamin E supplements. The small amount found in a standard daily multivitamin is generally considered safe, but your best and safest sources are from food: almonds, sunflower seeds, spinach, and avocados. The final member of our too much of a good thing group is the mineral iron. Iron is absolutely vital for life. It is a key component of hemoglobin in our red blood cells, responsible for carrying oxygen from our lungs to every single cell in our body. Iron deficiency is a real and serious condition called anemia, which causes fatigue, weakness, and shortness of breath. Because of this, many people, especially those feeling tired, will reach for an iron supplement, assuming they must be low. This can be a very dangerous mistake for seniors. While iron deficiency can occur in older adults, often due to internal bleeding or poor absorption, iron overload is also a serious and damaging condition. Unlike other minerals, our bodies have no efficient way to get rid of excess iron. It simply accumulates in our organs, particularly the liver, the heart, and the pancreas, where it can cause significant damage and a condition known as hemochromatosis. Most seniors, especially postmenopausal women and men, do not need supplemental iron. Their iron needs have decreased compared to their younger years. Taking an iron supplement when it is not needed can lead to iron toxicity and can also cause severe constipation, a common and miserable side effect. The rule for iron is absolute and non-negotiable. Never, ever take an iron supplement unless you have been specifically diagnosed with iron deficiency anemia by a doctor through a blood test. Feeling tired is not a diagnosis. It can be a symptom of hundreds of different things. Self-prescribing iron is a gamble with your health that you should never take. Now let's move into our second category, a group of supplements that are particularly perilous because they are so often marketed as gentle, natural, and safe. We are going to discuss the hidden dangers of popular herbal supplements. Herbs are nature's chemistry lab. They contain potent, biologically active compounds. In essence, they are drugs. The critical difference is that unlike prescription drugs, they are not regulated for safety, efficacy, or purity by the Food and Drug Administration. And most dangerously, they can interact with prescription medications in life-threatening ways. Seniors are particularly at risk because they are more likely to be taking multiple prescription medications for chronic conditions. Let's begin with one of the most notorious offenders, St. John's wort. This yellow-flowered plant has been used for centuries and is widely marketed today as a natural remedy for mild depression or low mood. While some studies have shown it may have some benefit, it comes with a catastrophic risk for anyone taking prescription medication. St. John's wort is a powerful inducer of a critical enzyme system in the liver, known as the cytochrome P450 system. Think of this enzyme system as your body's main processing plant for medications. St. John's wort effectively puts this processing plant into overdrive, causing it to break down and clear certain drugs from your system much faster than normal. The result is that the medication you depend on can become ineffective or completely useless. The list of medications affected by St. John's wort is terrifyingly long. It includes life-saving drugs like blood thinners, where a loss of efficacy could lead to a stroke, heart medications like digoxin, where changes in levels can be toxic, cholesterol-lowering statins, immunosuppressants for organ transplant patients, and many, many more. It can even cause a dangerous condition called serotonin syndrome when taken with prescription antidepressants. For any senior taking any prescription medication, St. John's wort is an unacceptable risk and should be avoided at all costs. There are safe and effective, evidence-based treatments for depression that should be discussed with your doctor. Next, let's discuss ginkgo biloba. Derived from the leaves of the ancient ginkgo tree, this supplement is one of the most popular herbal remedies in the world, heavily marketed with the promise of boosting memory and preventing age-related cognitive decline. For years, people have taken it in the hopes of keeping their minds sharp. However, the largest and most rigorous clinical trials, including the Ginkgo Evaluation of Memory study, which involved over 3,000 older adults, found that ginkgo biloba was completely ineffective at preventing dementia or cognitive decline. So at best, it's a waste of money. But at worst, it's dangerous. The primary action of ginkgo is that it has a blood-thinning effect. It can inhibit platelet aggregation, which is a key step in the formation of blood clots. Now, imagine a senior who is already taking a daily low-dose aspirin for heart health, or a prescription anticoagulant like warfarin or clopidogrel. Adding ginkgo biloba to this regimen is like double-dipping in blood thinners. It dramatically increases the risk of a serious bleeding event, such as gastrointestinal bleeding or a hemorrhagic stroke. Given that the evidence for its benefit is virtually non-existent and the risk of bleeding is very real, the conclusion is simple. Ginkgo biloba should be avoided by seniors, especially those on any type of blood-thinning medication. Our third herbal supplement to avoid is kava. Kava is a plant from the Pacific Islands, and its root is used to make a drink and supplements that are promoted for anxiety relief and as a sleep aid. And while it may have some anti-anxiety effects, it comes with a devastating potential side effect: severe liver damage. There have been numerous reports worldwide of kava use leading to hepatotoxicity, including hepatitis, cirrhosis, and even complete liver failure requiring an emergency liver transplant. The risk is so significant that kava has been banned or restricted in many countries, including Canada and parts of Europe. For seniors, this risk is magnified. An older adult may have pre-existing, undiagnosed liver issues, or they may be taking other common medications that are also processed by the liver, such as statins for cholesterol, or even regular use of acetaminophen for pain. Combining kava with these can overwhelm the liver and lead to a catastrophic outcome. The potential for irreversible liver damage is an unacceptably high price to pay for an anti-anxiety effect, especially when there are many safer and well-studied alternatives, from mindfulness and therapy to safe prescription medications, that can be explored with a doctor. Let's now transition to our third category, which I call the controversial and commonly misused supplements. These are substances that are often taken with good intentions, but based on outdated information or a misunderstanding of how they work, leading to potential harm. Our first example is high-dose calcium supplements. For decades, the message to seniors, especially women, was simple and emphatic: take calcium to prevent osteoporosis. This led to millions of people taking 1,200 or 1,500 milligrams of calcium in supplement form every single day, on top of what they were getting in their diet. While calcium is absolutely essential for bone health, the scientific pendulum has swung back significantly regarding the wisdom of these high-dose supplements. More recent research has raised some serious concerns. Firstly, studies have shown a clear link between taking high-dose calcium supplements and an increased risk of developing painful kidney stones. Secondly, and more worrisomely, some large observational studies have suggested a potential link between high-dose calcium from supplements not from food, and an increased risk of heart attacks and cardiovascular events. The hypothesis is that a large concentrated bolus of calcium from a supplement can lead to a spike in blood calcium levels, which may contribute to the calcification or hardening of arteries. This has led to a major shift in thinking. The new paradigm is a food-first approach. The best and safest way to get your calcium is from dietary sources like plain yogurt, kefir, cheese, sardines with bones, tofu, and dark leafy greens. Your body is designed to absorb calcium from food slowly and efficiently. Supplements should only be used to top up your intake if you are unable to reach your daily recommended amount through diet alone. For example, if your goal is 1,200 milligrams and you know you get about 700 from your food, you would supplement with just 500 milligrams, not 1,200. It is crucial to have a conversation with your doctor. They can help you estimate your dietary intake and recommend a safe and appropriate supplement dose, if one is needed at all. And remember, calcium doesn't work in a vacuum. It needs its partners, vitamin D for absorption and vitamin K2 for proper utilization, to be effective for bone health. So the key takeaway is to avoid indiscriminately taking large megadoses of calcium. The second item in this category is the entire industry of detox and cleanse products. You see them advertised everywhere.